and Alex usually set it up. Are we live? I hope so. Fingers crossed. I'm looking over at the other screen. We're live. Woohoo! Welcome to the Medicare Cafe. I know
I could not have done it.
I'm seriously shocked. This whole new system is a whole new world. You guys have no idea. I am the producer for this show, but I have to have a lot of help with the tech aspect of it, which is like, isn't that your job? Questionable. But you know what? It's not my job today.
But you did it successfully.
I did do it. We're learning it. Hopefully it looks and sounds a lot better. I think it does. So, new process.
Have we gotten any feedback on the new setup?
We haven't. You
Give
guys.
us feedback, guys.
Yeah,
Give
you
us
guys.
feedback.
Oh no, the chat's not working. Alex, if you're watching this, please come to the studio and help us with the chat.
I can see way over there.
Yes, over there. You guys, I have this mouse that is connected to a USB that's all the way to the computer, like a USB extender.
And I thought she had a 10 key. I thought she was going to do taxes. But no, this is to control the slides.
There's something seriously wrong with me if I am doing my own taxes. That's why I got married, and my husband knows it. I'm like, I was sick of paying someone to do this, and I'm not doing it myself, so.
Oh, that's hilarious.
Just kidding. He's wonderful. Luke, if you're watching this, you're not. But you're more than just my tax man. Welcome to the Medicare Cafe today. It's already 10 o'clock, so I guess we don't have any pre-chat, just me being here like, starting it off. But welcome, guys. My name is Sadie Palmer. Like I said, I am the producer. Usually I'm behind the scenes, but the flu has hit our office.
Oh,
and
I was
so
wondering where everybody is.
Yes. Olivia actually is in a fancy meeting in St. Louis, but everybody else has the flu. I had the flu over Christmas, so I got it out of the way, thankfully.
Good.
So now we're here today.
Had it yet, knock on wood.
Yes. And then Carrie, I guess it's just been a couple weeks since you've been here.
It's just been a couple weeks. Yeah.
Yeah.
My calendar did something real tricky. I don't know. I don't know if Olivia shared that with you. For the last 2 years, I've had a recurring, in an Outlook, a recurring first of the month and the third of the month.
Mm-hmm.
Something happened in February. I don't know if the system didn't understand the 4-week. I don't know.
Sure.
But it was on February 3 weeks in a row.
Yep.
Somehow.
Yeah.
So I missed last week.
Womp,
but I'm
womp.
here 2 weeks in a row.
Yeah. Hooray.
So, yeah.
We're happy to have you. Guys, let me see if I clicked the right slide. Nope. Hooray. There we go. Number 2. Guys, we can't see the chat right now. I'm not entirely sure why.
Says no viewers.
That's a good question.
Which it doesn't usually say that.
Oh, shoot. Okay. For some reason, let me see. You're right. You're so right. I'm going to stop this stream really quick. Okay. Seriously.
We're going to try this again.
Seriously, fingers crossed. If this doesn't work.
Oh, Siri. Thought I said Siri instead of sorry. Wait, I think that says 1 viewer.
Do we?
Well, there's 1 up there.
Okay. Let me message Alex.
Sorry, guys, if you can hear us.
Yeah, really sorry.
YouTube setting was on private, so nobody could see. It says 3 now.
Oh my gosh. Okay, are we live?
Are we live? Somebody type in the chat.
Really hoping.
We don't know if the chat's working.
Yeah, honestly.
Text Sadie.
Everything's falling apart. Here, let me put up the banner. The chat on YouTube isn't working, so text this number right here if you are watching us right now.
See us and hear us.
And
please.
that way we can chit chat with you. I have our tech guy. Hey, we don't know if we're live or not. Okay, well, it looks like people are on now.
Yeah,
okay.
I just kept refreshing.
Okay.
Here, I went back to the beginning and could see the first little bit, and then it was just stuck on the one.
Okay, everyone, we're good now. Though the chat isn't working, I'm not sure exactly why the chat isn't working. Carrie, let's just go ahead and get started.
Okay,
this has been chaos. So sorry.
I'm going to get asked a bunch of questions today, I think.
Yes.
Hit me with
today,
them.
we are going to have questions for Carrie. I wish we had a little soundboard thingy. That way we
Oh
could be
my
like,
gosh.
yeah.
You need that.
But
Olivia doesn't need to be in charge of that.
no, that's exactly right. That's why we haven't done it. We're like, we can't give her the button.
No.
She can't have the button. Okay. There's not going to be any slides today because I'm just going to kind of freestyle this. I did
Okay.
come up with questions myself, but then I also asked some other agents that we work closely
Okay.
with some questions that just what do agents want to hear from other agents?
Okay,
So
I hope I can
we
answer.
have some
Hope I
questions.
can answer those.
The first one's probably going to be the hardest. Who are you, Carrie?
Who am I? My name is Carrie Vogt, and I work for Senior Benefit Services. I am an insurance agent. I am also a certified financial planner and a registered Social Security analyst. Basically, all of that just means I'm what I like to say, financial professional who specializes in Medicare and Social Security.
Love, that's a good title. How long have you been in the industry? How long have you been taking Medicare clients?
Just taking Medicare, I'm in my 6th year.
Awesome.
Yeah.
Cool.
And
cool,
then before that, I had 4 years in the financial business where I primarily was doing retirement planning and trying to niche in Medicare while I was doing that, but then realized I got to specialize just in insurance. I can't have all my eggs in have my eggs in too many baskets.
So whenever you switched over to just taking Medicare clients,
Mhm.
you already, obviously, because you were working with some people, you already had some of those partnerships set up. But whenever you started to, obviously like a big thing
Mhm.
that like your expertise is networking partners, working with new partners, getting leads that way,
Yep.
which is something we always say. This industry is so lead hungry that it's like if you can find a streamlined way,
Yeah.
like that's such a great way in order to get leads, and that way you're not sending out postcards and all that sorts of stuff. So
Right.
all that to be said, whenever you are taking on a new networking partner,
Mhm.
what does that look like? How are you meeting these new financial partners? How long is the process? What does the process look like? Are you reaching out to them? I guess there's a million questions in that. How
Yeah.
are you meeting
How am I
these
meeting them?
networking partners?
So when I first started, it was, I was a part of all kinds of different financial planning groups. And the whole reason I decided to niche in Medicare is because when I was at those groups, consistently hearing from all these financial advisors that, oh my gosh, I'm really struggling with finding Medicare help. I heard it firsthand from all of them. And so I decided I'm going to be the solution. I'm going to niche in Medicare. So then I went back to all those advisors that I knew and I said, hey, listen, I'm actually specializing in Medicare now. Let me help you with your Medicare age client. So I first went to all of those advisors that I personally had already known.
Mm-hmm.
And then I asked them, can you connect me with other advisors?
Okay.
So a lot of that was huge. And I feel like people think it's hard to ask for referrals,
Mm-hmm.
but I don't know why that was easy for me.
Right.
It seems harder than it is. I think you just have to ask the question of, who do you know that I should know?
Mm-hmm.
And what other advisors, because it's rare to have a financial advisor who's independent. Like
Yeah.
usually they're a part of a firm with 20 different advisors or multiple branches.
Mm-hmm.
So, I might, for instance, a firm that I help in Kansas City, I got in with one of them and I now work with like 9 advisors at the company.
Nice. Yeah.
Just because they all talk,
Mhm.
and so I've done seminars for multiple of the advisors and then those advisors come to those seminars.
Yeah.
So, that's one way is asking my current networking partners
Yeah.
for more.
Just asking.
Just asking.
Yeah.
And then also when I first started my very first year, I did a ton of actual networking, putting myself out there in BNIs, Rotaries, those types of clubs,
Yeah.
chamber events,
Local
to
stuff.
just
Yeah.
talk about what I'm doing.
Yeah.
And
Yeah.
that was huge.
That's awesome. So whenever you are connected to a new partner, what does that process look like? It might be a little bit more streamlined because a lot of your partners are, connected to each other, in which they might
Uh-huh.
work in the same, but are you reaching out? Do you have to reach out multiple times? What does that look like? Or is it normally, another question I'm going to add in there, do you feel like financial planners are really looking for someone
I
to
do.
do this?
I do.
Okay.
I can't think of any that weren't receptive to like, oh my gosh, yes, like there's been a missing piece in my planning service. This is great.
Mm-hmm.
Now, some are going to refer you more than others,
Sure.
but that just might be their, some financial advisors, like one client of theirs could have 20 million that they're
Right.
holding. So like they might not have a ton of clients for you. So that's something that I think you have to also be aware of with financial advisors. Some people might have 500 clients because they're administering 401ks.
Yeah.
Other people might have 10 very wealthy clients that they're working with. So not all financial advisors are the same in that regard. But sorry, I kind of derailed us
No,
there.
that's great.
I would initially email or call. Sometimes I would reach out to a brand new one on LinkedIn.
Mm-hmm.
But I would reach out and ask them, can I take you to coffee or take you to lunch, and just talk about what I do and learn about your business.
Yeah.
Everybody wants to talk about themselves. I
Mhm.
always would start with, tell me about your business. And then usually from there, I would ask, can I have another meeting with you at your office and other advisors you work with, if you have them, where I do a full 101 Medicare 101 presentation to the advisors?
Yeah.
Because once they see how in depth what we do is,
Sure.
they're like, oh my gosh, this is so great for my clients.
Yeah.
So I do a full Medicare 101 to all of my new relationships with
Yeah.
financial advisors.
What do you think is and maybe you've already kind of answered this, but what do you think is the draw for, what do they get in exchange? I guess I should say, what are they getting out of the relationship? Why would a financial planner or other networking partners look at someone and go, yes, this is worth my time just referring them?
Yeah.
Does that make sense?
Yep.
Rather than just like, they'll figure it out. What's that exchange there?
So I am helping them in their planning process. So like financial planners, they have somebody, they want to get clients who just come to them for everything.
Yeah.
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 And so because they're more likely to handle all of their assets if they can answer all of their questions.
For sure.
So if they can tell them, hey, here's an accountant that will help you with your estate taxes. Here is an attorney that's going to write your will and trust.
Yeah.
Here is a Medicare insurance agent who's going to help you with your health insurance.
Yes.
And so and a lot of times I meet with the clients at their offices,
mm-hmm.
and they present me as she's a part of our team. Some clients truly, I don't think, know that I'm not working
like
for
actually
that
part of the
company.
team. Sure.
Yeah.
Yeah.
Because we meet in their office and I'm presented with the financial advisors as a part of them.
Yeah.
It doesn't cost the financial advisor anything.
Sure.
But that's what, they're not just going to refer you until they trust you. So that's what I think doing a full in-depth Medicare 101 with them shows how knowledgeable I am and how much of a resource I can be, so that I can truly help their clients.
And I would think it would be a domino effect in which the more that you're referred down the line, the less maybe you'd probably have to prove that so
Yeah.
maybe it gets easier as you go
Yep.
on, I would assume.
Yep.
Correct me if I'm wrong, but as you go on, well, it's like, well, he referred them and I trust you if
Yep.
this buddy is
That's how
doing
it
that.
is with Edward Jones. There's probably 40 Edward Jones advisors that I work with, and I may have only met 20 of them.
Yeah.
Because they all have their own Edward Jones, referral sort or resources within their company.
Mhm.
And they just say, hey, use Carrie. Because it's coming from a trusted source, they'll send me business.
Yeah.
Even though they've never met me, because they just trust whoever's telling them.
Yeah. Yeah, absolutely.
Yeah.
Okay, so I want to switch over because we have a hard stop today in about 10 minutes.
Sorry.
I want to switch over a little bit more to how you're dealing with clients and different things like that. So I had another agent that we work with bring me some questions that they would want to hear from Carrie. And one of those things was something he always likes to hear from other agents is whenever you are working with a client and you're advising them to go one way or another, and there's objections, there's some blocks. Maybe you're saying this is probably going to fit your lifestyle maybe a little bit better, whatever it may be. Those objections where they might come in a little bit in a way, like maybe not like trust what you're saying. It might be a new agent or a new client or something like that. How do you overcome those objections?
That's kind of hard because it would depend on the objection.
Sure.
I'm trying to think of one I had recently. There was a client who just flat out asked me, like, how do I not know you're going to tell me to choose Anthem because you're getting paid more than if I go with United Healthcare? You know, like they were skeptical of me being a broker. Who's going to pay me more? And I feel like the best thing that I can do for any objection is to be just completely honest. And usually that has always worked out well, you know, like in that instance, I would just say I get paid. I mean, and I hope I'm not misstepping because I'm really bad at like knowing my own commissions. But like, you know, I'm like, for the supplements, like they might differ $5 to $10. Like it makes no difference to me,
right,
which one you pick. In my bottom dollar, it does not matter which one you pick.
Right.
I'm trying to think of other objections.
Or even like, how do you deal with rough clients? How do you do, like, what's your process?
I mean, I validate, I guess maybe I'm taking that as concerns that they have. Like I validate their concerns. Like if someone says, well, I hear terrible things about Medicare Advantage plans.
Yeah.
And I always say, I'm sure you've heard that. And some of them might really be true. Some of them might be completely false. You know, Medicare Advantage plans sometimes get a bad reputation because people sign up for it through the TV or they sign up through the mail. They didn't work with an actual insurance agent to tell them, hey, before you sign up for this plan, let's make sure your doctors are in network. Let's make sure your drugs are covered. So if somebody just willy-nilly signs up for a Medicare Advantage plan and their doctors aren't in network, their drugs aren't covered, you can understand why they're going to start bad-mouthing Advantage plans.
For sure. Yeah.
So like, I don't know. That's, I guess, how I would address a concern like that or an objection.
You know, something that I am wondering, like looking forward, we're seeing that Medicare supplements obviously are becoming more and more expensive. They're kind of becoming a bit more of a luxury sort of item. Though this last AEP, Medicare supplements were written a lot more than I think what we expected because of like the rate increases. But moving forward with those, we don't know how long these rate increases are going to keep going and they're just getting bigger and bigger. But with people who are maybe new to Medicare and haven't had an agent that kind of talks them through the pros and cons of both sides. I wonder what it's going to look like to have an appointment where the Medicare supplement is maybe too expensive for them, whether what they prefer, what they can actually afford, but they don't want to go with a Medicare Advantage plan because they've heard all these like different things. I wonder if there's going to be like some sort of pushback or what there's not a question in that. This is just me like thinking. Like I wonder what those conversations will look like. But I mean, I don't know. I don't take clients. So it's like, are you really even getting like with the Medicare supplement stuff, are you really even getting sort of pushback on the prices or like what did those conversations look like?
My clients are a little skewed, so I'm a little bit different, I think, than the usual just because so many of my referrals are more affluent.
Sure.
So
yeah, that makes sense.
It is a little bit more feasible for them to pay that. But at the same time, people with a lot of money get that way because they're penny pinchers.
Yes.
And so sometimes they're like, I go to the doctor once a year. Why am I going to pay $200 more a month when I can do this? And so, I mean, I'm very upfront about like, I tell them the risks, the pros and cons of each. And then I'm like, listen, you know, some people sleep better at night, paying more money up front knowing that they don't have prior authorization risk, they don't have network risk.
Yeah.
Other people, you know, maybe it's you have the assets that you can afford a larger bill, a larger out of pocket if if something were to happen to you. So saving that money up front, that might make you sleep better at night by saving your money up front, and you understand that, you'll call me if you get referred to a certain doctor, and you'll understand that if you're traveling, these might be your restrictions. So
Yeah. Yeah.
I mean, I see all of that now.
Sure.
I guess what you're saying.
Yes. Yeah. I think this next year will be really, really interesting to see because, you do work with, like a certain demographic just because of where you're getting your leads in. But like you said, like sometimes people that's why we need agents, is because you can assume something about someone and realize like, oh, they're like the opposite. My husband is such a penny pincher. He's and so he'll act like he is dirt poor. We have no money, but like we've saved a lot, and you know, like we don't spend money on like other things. So you just never know. So it'll be interesting going forward this year to see what with all these just different changes that are happening. We thought this last AEP was going to be, oh my gosh, like so crazy. It was crazy, but like we're like, okay, so this next AEP might be crazy. Yeah.
Well, and I think like if someone's really torn about the price, but they don't want a Medicare Advantage, like I always try to hone in on, okay, what is it that they like? Like if they like having the nationwide network and no prior authorizations, but the price is too much, then I really try and sell a high deductible G. If they just really can't afford it, like they're leaning towards a Medicare Advantage, they're fine with the networks, like, that's when I'm going to talk about, well, maybe let's add on a hip. And, so it's exactly right of why it's so important to work with a professional. Like what we do, why we're so important, because we can tailor our recommendations to what they need.
Yeah, for sure. Last question I have for you, since we have just a couple minutes before you got to get off. What do you feel makes you unique as an agent?
Oh, goodness.
Yeah.
Interesting. Man, that one caught me off guard. What makes me unique?
What do you feel that you bring to the table that is something that you're like, this is a good trait about me. This is something that I do that I feel makes me really good for this business.
This is the hardest interview question I've ever had.
It wasn't mine. It was also, this was what I also got from another agent.
I think, and this sounds so bad, if somebody asked me, I think I'm a really bad salesperson because I am not motivated by money.
Sure.
And I am like I said, I'm too honest with my clients sometimes. And like, I think I miss out on a lot of ancillary products because wait, what makes me unique? Okay.
Yes.
I was going to say somehow I'm spinning.
What's
this
good? I know. I was like, don't,
what's bad.
I know. I was like, don't start talking mad S on yourself right now.
I was thinking the opposite of what makes me unique. Man, Sadie, I don't know.
You know what? Can I answer this for what I
Please
think makes you
Please
unique?
do.
I think that
because I don't know.
What you just said was a testament to how awesome having networking partners can be. The situation that you have set yourself up in, you don't have to worry about, when's my next lead going to come in? When's my next lead going to come in? You have a steady flow.
Yes, I agree with that. I was thinking what makes me different with clients.
Well, I was to add on to that. I think because of that, you've set yourself up so well. You have a little bit more of a luxury to not feel like you have to push that sales side, and you can be a bit more honest.
That's
and
very true.
You can feel a lot more honest maybe with your answers, because not that it's dishonest if not, but you have only one motive because you don't have to worry about that generation lead. I think that speaks like you've just set yourself up so well.
You answered that question way better than I did.
I think honestly I wasn't looking for that answer. I just thought of it. But Carrie, that's all I have for you today.
Well, thank you. Sorry to end. I feel like I ended it terribly.
Oh my gosh,
I didn't even have a good answer to that.
No,
one.
not at all. That's hard. It's hard
It
to.
is hard.
Yeah.
I was trying to think of like my clients, like what I continuously hear from them, which I don't
Mhm.
know if they're telling other people, but I hear thanks a lot for your professionalism.
Yeah. Yes.
So
That's
maybe
lovely.
I'm more professional than
Yeah.
others. I don't know.
We spend all day, whenever you care about your job, you spend all day thinking about the things that you can improve. And we
Yeah.
don't take time to like think about the things that maybe we've done right. So
Yeah.
I just wanted to ask you.
Yeah. Well, I'm glad. Got me thinking on some
Yeah,
things.
good. Okay, guys, that's what we have for you today. So sorry again for, I don't know how many times I'm going to have to apologize. I feel like there's always tech issues whenever I'm on the screen. Maybe I'm just bad juju for this, but thank you so much. So sorry the chat wasn't working today, but you can always
Thanks,
text these
guys.
numbers. You can always contact us at Senior Marketing Specialist. We love to chit chat with you guys. Send us an email, whatever. And then also that Facebook page. You can check us out there. But we have to get going.
We'll see
So,
you next time.
yes, see you guys next time. Have fun
Make money
and give impeccable
impeccable
service.
Can't